Hello, welcome to today's session. I'm thrilled to be joined today by the newest member of our team, May, who is based in the Philippines. So May, come on camera and introduce yourself.
Hello, kumusta kayo mga Kunars and all the healthcare professionals all around the world? Welcome to the OET Ready webinar series. My name is May Miklat, the education specialist for OET here in the Philippines. And virtually with me is Rebecca Bush, the OET's teaching and learning manager. So I will be starting the live now, and I hope you will be sharing this live among your friends, most especially your nursing friends and other people in the healthcare profession. So we're now approaching the final stretch of this series. Time really does fly when you're learning and growing together, right? So we know that preparing for an English test takes time and effort, and we're grateful to be part of that journey with you. And the good news is that this isn't the end. Later, we'll know that how excited we are to support you every step of the way. In this session, we'll get to know OET speaking, then review three skills with some guide practice. I'll share some tips and tools to improve speaking, and we'll have Q and A at the end. If that sounds clear regarding the journey you will have with me and Rebecca, can I have a like reaction in the comment section? All right. Okay, thank you so much for everybody tuning in and making that chat very lively. All right. So in Filipino, we have this concept bayanihan, the spirit of unity and mutual support. This perfectly reflects what OET stands for. For us, it's about empowering healthcare professionals like you to succeed, not just on paper, but in actual practice. That's why we're excited to say that our reading, listening, speaking, and writing courses designed specifically for healthcare professionals like you are made much easier to avail. In these courses, you can learn at your own pace, anytime, anywhere. You can also go beyond test taking with real communication strategies, master techniques to handle different healthcare interactions, get hands on practice with fresh, updated materials, and sharpen your writing and speaking with targeted exercises. You can avail yourself 25% off in any of these courses using OET Ready 25. Again, that's OET Ready 25, and that coupon code will be available until the end of March. So, when you go to the OET store, do not forget to add the coupon code when checking out the courses you'd like to purchase. Again, that's OET Ready 25 until March 31. So now let's get to know the OET speaking test. OET speaking test is composed or consists of 5-minute role plays. You will receive a role play card and have 3 minutes to prepare for each role play. Each role play is specific to your profession. So if you're a nurse, you'll play the role of a nurse. You work with an interlocutor who takes the role of the patient or carer in each role play. The whole test takes around 20 minutes. If you're taking OET on paper, your speaking test will be in a room and face to face with the interlocutor at the venue. If you're taking OET on computer or OET at home, please be reminded that you will be completing the speaking test online with the interlocutor on a secure version of Zoom. If you're taking OET on paper, your ID check is basically a check of your passport or valid ID. Just make sure that the ID that you will be bringing or showing in a test day will be the same ID you used for registering for the test. For OET at home or on computer, there are some extra security checks, including a check of your room and your person, such as showing the interlocutor your wrists, ankles, glasses, and so on to ensure the test environment secure. Then there's a warm up, which takes around 2 to 3 minutes. Here, the interlocutor asks you some question about your professional background. This is just a chance for you to get comfortable with each other's voices. Then, you get your role card and 3 minutes to prepare. The first role play goes for 5 minutes. Then you get the next card and another 3 minutes to prepare for the second role play. You will be able to see the role play card throughout the role play, so don't you worry that you will need to memorize all that's in it. Note that only your role plays are assessed, and this is not the interlocutor. Two separate OET assessors listen to your role plays and rate your performance using the speaking assessment criteria, which you can find on our website, oet.com. Now that we've covered the basics of OET speaking, let's take a closer look at the role cards that you can see now on the screen. Each role card has 3 sections. For your speaking subtest, it is important to understand the setting. The setting shapes the way you will communicate, whether it's a hospital ward, patient's home, clinic, school, emergency department. Recognizing the setting helps you to respond appropriately and effectively. After setting, you will see the background or the background information, which gives you the relevant details about the patient's age, the reason for the healthcare visit, and whether this is a first visit or a prior relationship. You can also access in here information such as patient's details, medical issue, and nurse's role in the conversation. The background information also makes it clear if you're speaking to the patient directly or a relative of the patient. So, for example, if the patient is a child, you will be speaking to the patient's parent, and the card will say that the child is not present in the room. The final section, and as you can see in the screen, it's the longest part of the role play card, and it gives you instructions about what to say. You'll notice in this part we have specific verbs like confirm, explore, reassure, emphasize, and explain. These aren't just there for guidance. Think of them as cues that shape your interaction with the patient. For example, if the card says reassure the patient about their test results, it's not just you giving information. It's also about using a calm and empathetic tone to ease their concerns. Or if you're asked to explain the importance of following a treatment plan, your goal isn't just to list instructions on what to do, but you have to make the patient understand why it matters using clear and patient friendly language. The tasks in each role play card are carefully designed to encourage a natural back and forth exchange, just like you would in a real consultation. So, before we dive in to the key skills for the speaking test, let's take a moment to understand how your role play is assessed. I'll hand it over to Rebecca, who will guide us through these criteria in more detail. Rebecca?
Thanks, May. So, yeah, let's think about how the role plays are assessed. So, assessors mark your performance on 2 types of criteria: linguistic criteria and clinical communication criteria. Can we have the slides back up, May? Is that possible?
Yes.
Thank you. So, our linguistic criteria determine how assessors will score your language skills during the speaking subtest. And I wonder if you know all of the linguistic criteria. If you do, can you fill in the gaps? Type them into the chat for me. The first one's intelligibility, as you can see on the screen. Do you know the name of the other 3 criteria? How do we finish off the word starting with fla, for example? And what about the other 2? See who can be first to let me know. Great, well done. Shanu and Kagla, who are saying the second one is fluency. Great job. What about the third and fourth ones? How do we fill in those gaps? Tanuj is saying appropriateness for the third one. Great job. And one more to go, resources of what and what. Anju, well done. Grammar. Shanu as well saying grammar. And the final word that we're missing is expression. Good job. Resources of grammar and expression. And for the speaking subtest, assessors give you a score for each of these criterion, and this is called a band score. Do you know what is the band score for the 4 linguistic criteria? What are you scored out of for each of these criteria? Can anyone tell me in chat? How many marks are available for each of these criteria? Just give you a few more seconds. This maybe is a little bit more tricky. Close. That's close. They're out of 6 for the speaking test. So all of them are out of 6. And the second type of criteria are called the clinical communication criteria. But before we get onto that, sorry, I've skipped ahead in my notes. What you're seeing here are the linguistic assessment criteria that we've just described and the descriptors for each band score. And you can find this document in the FAQ section of the speaking page, and I'm posting that into the chat for you now. The criteria also come with a glossary that explains the focus for each criterion. And we want to recommend a speaking resource you shouldn't miss. It's also on the speaking page that I've just linked to in chat, and it's called our Ultimate Speaking Guide. Part 1 is dedicated to the linguistic criteria, where you can find explanations, examples, and tips to help you prepare. Now we'll move on to the second set of criteria. These are the clinical communication criteria, and there are 5 of them. But can you tell me what they are? See again if you can fill in the gaps for me. You can answer any in a out of order if you like, but have a go. What do you think the first word that's missing is? Yep, great. It is relationship building. Well done, Anju and Jacinta. What about the next one? Perhaps one of the most important ones, I think, for students to practice. Shanu's quick off the mark again. It is the patient's perspective, understanding and incorporating the patient's perspective. Providing structure. Good job, Shanu. That's number 3. And then we've got 2 that both start with information and 2 words that start with G. Anju, well done. Information gathering is one of them. And the last one, actually, I can see, Berry has just popped it in as well. Information giving. Well done. And Berry has preempted my next question, which is how many marks are available for these criteria? She's absolutely right. It is 3 marks that are available for each of these criteria. So again, here you can see all of them. And assessors look at how you demonstrate the indicators under each of the clinical communication criteria across both the role plays. So you shouldn't treat them as a checklist to try to cover in each role play. The idea is that you will cover off most of them across both of your role plays. And you're marked from 0 to 3 for each of the clinical communication criteria. Like the linguistic criteria, the clinical communication criteria also have a glossary which explains each one in more detail. And part 2 of our ultimate guide is covering off the clinical communication criteria. And again, it's a must-have resource. It's got plenty of real audio examples and tips to help you demonstrate the criteria. You should aim to achieve the highest level in the descriptors for each criteria. Test takers securing a B grade will have achieved predominantly scores of 5 out of 6 for each of the linguistic criteria and 2 out of 3 for the clinical communication criteria. And in summary, remember to visit the speaking page of our website where you can find all of those resources. I'm going to hand you back now to May for some tips on how to improve your speaking.
Thank you so much, Rebecca. In this section, we're going to focus on 5 ways that you can improve in the OET speaking subtest. So, the first suggestion we can give you is to initiate interaction with confidence. You set the tone for the entire conversation. It helps you establish trust, show professionalism, and demonstrate your ability to communicate effectively in an English speaking healthcare environment. This isn't just about answering questions, it's about guiding the conversation naturally, just as you would with a real patient. Now, let's do a quick knowledge check. Are you ready in the chat? Here's a question for you. Is there only one way to start an OET roleplay? What do you think? Is it true or false? I'll wait for 10 seconds. Let's see. I think we have some answers here from Kagla, very active in the chat. Let's see the correct answer. Also, Barry got also an answer in the chat. And the answer is false. So, if you said false, then you're absolutely right. There isn't just one way to set or to begin an OET role play. What really matters is how naturally and appropriately you agree with the patient. A strong start sets the tone for the conversation, and just like in real healthcare settings, flexibility and patient-centered communication are key. Now let's refer to the speaking glossary for an explanation for that. As part of the criterion relationship building, initiation involves greeting the patient, introducing yourself, clarifying the patient's name, and clarifying your role in their care. In real life, the first words of any conversation with a patient could reduce their anxiety or raise it. That is why it's so important to begin all interactions in an appropriate manner for the context given in the background information. Now, let's try a task. On the left side of your screen, you can see two introductions. I think I spoiled it. You can see some introductions. On the right are summary options of different situations. I'll give you a minute and match the opening of this situation. If you saw the first one, then you're very lucky. Then let's have first the first one for hello, Jane. I can see you're in a lot of pain. I can give you something for that, but I just need to ask you some questions first. Is that okay? So, for that context, what do you think is the situation, the summary option of the situation that would best align it to? Let me see your answer in the chat section. Let's see. What do you think? It's letter D? Okay. Hmm. Since you have there the clue you're in a lot of pain, what do you think? I can give you something for that, but I just need to ask you some questions. It's going to be correct. Letter C, urgent. Now let's have the second one. Hello, Jane. My name's Dina. I'm one of the doctors who's been looking after your daughter. I've come to give you an update and ask you a few questions. Is that okay? So we got letter C there. How about number two? What do you think will be the situation in which this introduction will be best assigned to? Okay, Ida said it's letter D. Kagla said it's letter D. And if your answer is letter D, then you are correct. We have here that the parents is one of the parents of the patient will be given an update on the child's condition. I think we have three more introductions here, and I'll give you 30 seconds to match them. And it's better if we have the number and then the letter of your answer for each number so I can really see if you got the answers correctly. For example, three, whether it's A, B, or E, and so on. Three, four, and five, and then the letter of your answer. Okay, let's see. I see some questions. I see some answers coming in our comment section. Kagla said it's E, B, A. Melody said that it's for number four, it's letter B. Hmm, let's see. And okay, Jana said for number three, it's A. For number four, it's B. And for number five, it's letter A. Let's see. Let's see if you got the correct answers. So three, it's E. Wow. For number four, it's B. And for number five, it's letter A. Correct. I see that, Kagla. Yeah. Melody for number four, Jana, and Nermine get the correct answer. Congratulations. Let's just have let's just have them all sequenced together. Now take a screenshot for later reference, but remember, these are examples only. This is not only the way to start a role play or to have an introduction. The best introductions definitely should be personalized to the patient and their healthcare situation. Now let's try another task. This time, the setting and background information are on the left, which I will be reading for you. Now choose the most appropriate way to start the interaction from the options on the right. Post your answer in the chat. For the setting, we have an emergency department. For the doctor, a the role here is the doctor. And for the background information, a parent presented 2 hours ago at the emergency department with his or her 4-year-old son. The boy had a 36-hour history of recurrent vomiting and stomach pain, which was diagnosed as viral gastroenteritis. He was given oral rehydration fluids and observed for 2 hours. You have just told the parent that it is safe to discharge him. The parent seems anxious. So, again, we have here another anxious parent. So, again, what is the most appropriate way to start the interaction? Let's see. Kagla said C. Mary had a different answer. She said it's letter B. Do you think? Oh, it's letter C too? I'll give, some little time for the others to answer this task. Oh, I can see based on your answer, it's mostly C. Let's see if you got it right. If your answer is letter C, that is the correct answer. Now, let's put your thinking to the test. Based on what we just discussed, how would you start the same interaction? Think about the setting that you were given and the background information from the one that you can see on the screen and type your answer in the chat. I'm really excited to see your responses. I'll give you 30 seconds to type in and see your answers in the comment section. 30 seconds starts now. Again, your answer can be just brief given that it's only 30 minutes. Let's see what interaction you will make out of this scenario or situation. You have a little more seconds. Let's see. Hmm. Maybe a little more time. Don't be scared or shy to share your answer to the comment section. It's also part of the learning activity or the learning nature itself. It's fine to post responses, even though it's not perfect. Maybe we can polish a little bit or discuss that. But if you need more time, that's okay. And definitely those activities are to share insight for and to share your understanding of the concepts that we are discussing. Oh, Barry said, sorry for the wait earlier, Mr. Taryn. Sean had done well and he is expected to be discharged. I think that's a good response. Manu also had a response here. Hello, Mr. Tran. Your son is now ready to be discharged, but you need to follow certain instructions through. Seem a little worried. Could you tell me whether something bothers you? That's also a good response too. Another one last. We have Mary. She said, your son will be discharged a little later. I can assure you that it is safe for him to go home. We have included a discharge plan for your son for you to follow. That's a good one. Thank you for your answers. We will be moving to the next slide. Then let's go to the second way you can improve your speaking, which is elicit and explore. Let's go back to our assessment criteria glossary to see what this means. Here we see that we need to elicit and explore the patient's ideas or concerns or expectations as part of the criterion understanding and incorporating the patient's perspective. Okay, so we will be playing an audio here, and then I want you to listen closely to the recording. Then I want you to answer this question. Does she explore his response, the patient's response? Let's play the audio.
Few minutes each day will be so good for you. Now, let's talk about your physiotherapy. Now, I think you're ready to start exercising again. I'd like you to go for a walk each day, just a few minutes to begin with. It's important for your recovery and also really good to help with your anxiety. How does that sound?
I'm not sure I feel ready to walk on the street.
There's nothing to worry about. Just a few minutes each day will be so good for you. Now, let's talk about your physiotherapy. Now, I think you're ready to start exercising again.
Let's see. Do you think the healthcare professional in the audio really explores the patient's concern? Answer in the chat and we'll see if we have the same answer. Hmm? What do you think? Was she did she really take her time? Mary said no. How about the others? Okay, Oli and Kagla also said no, and you are correct. She doesn't, and she moves on to the next topic. Now, let's see if we will let's see if we have to take this conversation a step further and imagine you're the healthcare professional in this scenario. How would you approach the patient's concern? Okay, so let's give it a try and let's see how you'd navigate this interaction with confidence and care. Again, if you were the healthcare professional in this situation, how would you really give time to the patient's interaction or the patient's response to really elicit and explore what he feels and what he currently is in? Correct, Barry. A while ago, she seems to wave it all off. But how about now? How would you respond so that will not be the case at all? See and search for answers in the comment section. No, just a sentence, just one sentence, or example, if sentence, if a sentence will not be good for you at the moment, it can be a phrase in which you think it can be better said to the patient. So there's really elicitation, and you can see that the healthcare professional in this situation really explores what the patient is feeling. So Mary said you can start by walking inside the house first if you are afraid walking on the street. That's a good solution. Douglas said, I see. It can be hard and to take some time to going back to streets for a walk, but I assure you it would be easier day to day. Try not to worry. Very empathetic. Nice responses and great effort. I really appreciate you to those who are sharing their answers in the chat. It's fantastic to see your enthusiasm and willingness to participate. Last one from Manu. Hmm, I understand it's quite a big step. Do not worry, we will take one step at a time. You are not alone in this. We are here to support you. That's a good response too. Now let's listen to another version and let's see how can this be different if we start and observe proper elicitation and exploration of the patient's condition or situation.
Now I think you're ready to start exercising again. I'd like you to go for a walk each day, just a few minutes to begin with. It's important for your recovery and also really good to help with your anxiety. How does that sound?
I'm not sure I feel ready to walk on the street.
Okay, what worries you about walking on the street?
Oh, I just don't feel safe on my own. I'm worried I'll fall over again or something.
I see. You feel vulnerable walking alone. I can understand that. So, how about we get someone to join you? A friend, perhaps?
Oh, that would be good.
Now I think you're ready to start exercising again.
Mm-hmm. I think those whom those those answers we flashed in the screen a while ago and those answers that are in the comment section, it's very similar or somehow similar to how elicitation and exploration can be done and observed in such a situation. In the conversation you heard, the healthcare professional explore the concern with open questions, such as asking, okay, what worries you about walking on the street? So you can see that the healthcare professional really take it step by step to really understand where the patient is coming from. And then there's the response. She paraphrased the feeling of the patient by saying, I see, you feel vulnerable walking alone. I can understand that. So there's the empathy, and then she offered a suggestion about his concern. So, how about we get someone to join you? A friend, perhaps? Now, um, for the third one, we can use appropriate questioning techniques. And for this one, we will be using the inverted triangle framework. In this inverted triangle framework, you can see that it starts with open questioning techniques, such as what brings you here today? Can you tell me more about that? How have you been feeling since I last saw you? And then the questions will be increasingly specific until you reach some kind of question, such as, are you exercising regularly? Is the pain getting worse? Have you had a similar rash before? So let's see. We'll have another activity, and then I want you to complete these questions which you might be asking your patients. I would like you to write in order your answers to complete these questions in the comment section. Let's see. I'll give you 30 seconds to complete them. Okay, someone said tell. How about letter B, C, and D? Manu said for B, it's did. Mm-hmm. I think Ollie answered for letter C. For Marie, it's tell, when, and do. Ishara has tell, do, have, brings. Those are her answers. Let's try. Let's go through each question one by one. For letter A, could you tell me a bit more about the pain? For B, it's do you find the pain worse at certain times of the day? For C, what have you done to manage the pain so far? And letter D, what do you think? So, what brings you here today? Correct. Thank you so much for your answers. Now, if you would put all these questions in a logical order? How would you arrange these questions from open to close sections? A while ago, I gave you 30 seconds, but this time, let's make the time shorter. I'll give you 20 seconds, and please drop your answers in the comments by listing down the sequence of letters in the right order. Let's see who will get it right. 20 seconds is running. Let's see who will get the correct answer. Wee Tong said it's D, A, B, and C. How about the others? TIBC, I think most of you have the same answer. And let's see. D, A, B, and C. Congratulations to those who got it right. Wonderful work. So, as you can see, the first couple of questions aim to understand the problem from the patient's perspective. And then later, the approach becomes more focused with increasingly specific and then closed questions. Now, let's go and discuss what types of questions should you avoid asking in an OET speaking subtest. First of all, please do not use compound questions. What are compound questions? Compound questions are those questions with two or more questions being asked. That's why compound. So, for example, are you sleeping well and getting enough exercise, eating healthy? If I would be the patient who will be asked of this question, I don't know which of the questions should I answer first. Should I answer about how I am sleeping, or do I have time to get exercise, or should I switch to the second question, eating healthy? If you would also giving or providing compound questions, I think it's not, I believe, if your aim is to really elicit and explore the situation of the patient, it's hard for the patient to really get through the situation or what he or she is feeling at present. Another question that you should try to avoid is asking leading question. These are questions that push the responder to a particular answer. For example, you're taking the tablets twice a day, right? Again, if I would be the patient and I would be asked this question, it's hard for me to say, no, I forgot, because I might send the idea that I am really neglecting the right medication that was prescribed to me. So, again, avoid compound questions and leading questions. Let's see. If we are trying to avoid them, how can we make the question open from its original idea of being a leading question? We have a leading question on the screen. You're not exercising much. Okay? So how would you make it an open question? Let's see if we have people here who ready to take up this challenge and transform this leading question to an open question. I'll give you 20 seconds to think about what can be the question right for this situation. While we are waiting for the answer for this task, again, I would like to thank everyone for your effort, for giving all your participation very visible in the comment section. Mary said, how much do you exercise? Barry, could you tell me how much exercise you do daily? Nerman, how often do you exercise regularly? Or for Chatty, how often do you exercise? Let's see if your answers are close to the given answer here. How often do you exercise? You got it right, and you're really listening very keenly. Let's have the next one. This is a leading question. Let's make it open. Is the rash sore or itchy or bumpy? Let's see, another 20 seconds for you to change this leading question to an open one. Let's see your answers in the comment section. Bilgia said, "What type is your rash?" Ishara said, "Tell me more about the rash you got." Mm-hmm. Good answers from Bilgia and Ishara. Let's see. Can you tell me about how the rash feels? Your responses are very close to the sample answer on the slide. Very good. Now, chunk and check. It's very important for us to chunk and check, especially when providing information to the patient. Let's see what it means to chunk and check information. Let's listen to a recording.
So, what I'd like you to do is visit the community health center. There are classes there, exercise classes and relaxation and breathing sessions. I'd like you to try a few classes 2 or 3 times a week for the next few weeks. Also, I'd like you to make an appointment with a dietitian.
So as you can see in the situation here, it's very fast. It feels like if I would be the patient, I could not keep up with everything that the healthcare professional told me. I may just, nod and pretend that I understood what the healthcare professional said when authentically or to be true, I was not able to get what she said at all. So let's hear another recording and tell me if the speaker pauses enough and checks the patient's understanding when the recorder ends or when the recording ends.
So, what I'd
Answer in
like you
chat
to
for
do
10
is
seconds.
visit the community health center. Do you know where it is?
Yep.
There are classes there, exercise classes and relaxation and breathing sessions.
Okay.
I'd like you to try a few classes 2 or 3 times a week for the next few weeks. Would that be manageable?
I'm not really sure how these classes will help.
It seems like a small thing, I know, but these activities can make a big difference to how you're feeling, and lots of people find a big change in their anxiety levels.
Okay, that makes sense, I guess.
So, do you think you can manage 2 classes a week?
Yeah, I can do that.
All right. If you hear the recording, there's much more interaction now. Kagla said that yes, in this scenario or in this conversation, it's much better because you can see that the healthcare professional is really chunking and checking for understanding. There are pauses, right? There are pauses there. And um what else? And we can see that it's it's a better way of engaging to a patient because in there the healthcare professional really took her time to ask question and to also elicit responses from the patient. As you can see in the clinical communication criteria, we have their indicators for information giving. In that criterion, we have several indicators, and those are establishing initially what the patient already knows, pausing periodically when giving information. So we don't have to rush when giving information. We really have to walk through the patient with the right information that he or she needs to understand, using the response to guide next steps, encouraging the patient to contribute reactions or feelings. Let's be empathetic. Let's see if everything is clear for the patient. Checking whether the patient has understood information, very good, to check whether the patient is really understanding us and discovering what further information the patient needs. So at the end of the day, when the patient walks out the door, he or she is very clear of the things he or she has to do or he or she has to take. So, in the recording, we know that she asked about what he already knows, but asking, "Do you know it?" There are a lot of pauses to check whether the conversation is really understood or the information given by the healthcare professional is clear to the patient, and also she invited him to contribute and check for understanding. Given that she asked the question, would that be manageable? Let's see. The last one is to be careful with formulaic language. This is something that can occur in real life, something that we can hear every day, but we might not realize it. But in a healthcare setting, it's not really helpful for us to raise these expressions. We should avoid empty or premature reassurance. For example, saying, don't worry, you don't worry, you don't worry about that, or nothing to worry about. For example, the patient said, I think my father is dying. Then it's not really nice to just cut off the feelings and respond, don't you worry about that. I think if there's a death in the family, especially if it's among the the core members of the family, it's not proper for us to say, don't you worry about that. There are many stages of grief, and there are so many things that one has to prepare, one has to arrange if someone close to us is close to that situation. So, to avoid that, it's better if we listen, accept, and acknowledge patient's view, then reassure him that something better will happen, or you will be in there to assist or to support him in whatever the patient is feeling right now. In a situation like this, for example, the patient would be saying, I'm worried I will have a scar forever. That's for many, that might be a trivial matter. But again, the patient is not comfortable of having that scar. You can say, I absolutely understand that you're worried about that. Empathy. This particular surgery can leave a small mark, the fact of the situation, but there are lots of ways to help prevent scarring, which we will go through. So you didn't just say nothing to worry about that. You give specific solution, or you provide the the right scenario in which the patient will have no worries, or lessen the worries that he or she is feeling. Next, avoid mechanical checking. What are the examples? Is that clear? Are you getting my point? Is it clear to you? Why you look so anxious? Now you might say these expressions are something that I can hear every day, something that exists in my everyday communication or conversation, but we can do so much better. You can check more authentically, and do or use more natural expressions, such as, does that make sense so far? Is everything clear for now? Or what do you think about that? You can also personalize your question so that you can give more authentic, more personalized question to the patient that is right for what the patient is feeling, or what the patient is actually, the condition of the patient. You can ask, how do you feel about that medication plan? If the patient is worried about the medication that he received, you can certainly ask this question to really check on the patient. Next, avoid formulaic empathy, such as saying, I understand your concern, without really expanding or asking the issue. I know how you feel. Again, the different people would be feeling different range of emotions. So expecting that you really feel, without really expanding and knowing the concern or the issue of the patient, we can do so much better. You can, to avoid that, you can be specific, you can personalize. That's why raising questions to really elicit the situation and give more statements, so you can explore the condition of the patient. That's very important, so you can personalize the things that you will be saying to the patient. Next, you can say, I know the thought of surgery can be scary. It's all right to feel anxious about the tests. So you may understand what the patient is going through, but just saying, I know how you feel, versus it's all right to feel anxious about the tests. It gives more valuation, it validates the feeling of the patient. Then I'll hand it over to Rebecca to really expand our learnings for today and provide you the sample role play extract. Rebecca?
Thanks, May.
Mhm.
So for this activity, we're going to see if you can recognize some of the skills that May has just been talking you through. I'm going to play part of a role play, and you're going to listen to a nurse talking to a patient. And as you listen, I want you to note in the chat anytime you hear one of those communication skills that May has just been talking about demonstrated. All right, so here comes the audio.
Hello, Dina. It's me, Nurse James from the clinic. I'm here for your checkup and to see how you're doing. How are you feeling today?
Actually, not great today.
Oh, that's no good. Can you tell me what you mean by not great?
Well, I've got this sore spot on my back, my lower back, and I'm just worried that it's a bed sore.
All right. I can see you're quite uncomfortable. So let me ask a few more questions before I have a look, and we'll take care of it, all right?
Okay.
So you said you've got a sore spot on your back. Can you tell me about how it first came on?
I guess I noticed it yesterday, and it's sort of a sore spot at the base of my spine.
Okay. So you first noticed it yesterday, and it's down low on your back. Can you explain the pain to me?
It's itchy, and it feels kind of warm and firm.
Firm. I see. That must be uncomfortable for you.
Yeah, I'm quite worried about it.
I can appreciate that, especially because you've been in bed for a while now after the surgery. So I'll have a look in a moment, but it does sound to me like a pressure ulcer, which is just another name for a bed sore. You mentioned that word before, so how much do you already know about bed sores?
Oh, not much.
Well, basically, it's an injury or sore on your skin, and it's quite common when a person is lying or sitting in the same position for a long time. That pressure can cause damage to the skin, to the tissue. Does that make sense?
Yes, I see.
The good news is, though, that it's treatable, and we've got it early, so it should clear up in no time. I'll explain the treatment if you like.
Okay.
The most important thing is to clean the area, which I'll do today, and then apply a special dressing to keep it clean. Does that sound all right?
Yes, but, I've seen pictures of people with bed sores, and they look awful. I'm just worried it'll get infected. I don't want that to happen to me.
Of course, yes, we don't want that. That kind of infection generally happens when a person has had the sore for a long time and hasn't treated it. But luckily, you've noticed it early and you've told me, so there's really very little risk of infection, and we'll get treatment started right away, okay?
Okay, I feel a bit better hearing that.
I'm glad. Now, in terms of prevention, since you're going to be in bed for a bit longer, let's talk about how to avoid this going forward, all right?
Oh, okay.
There are a few simple ways to prevent ulcers while you're in bed. First off is movement. You should try to change position regularly, every hour or two, just to keep the pressure from building up in one place. Would that be manageable?
Yes, I think so.
Great. As well as changing positions, it's a good idea to check your skin regularly, every day if possible. You might need someone to help check your back and your legs and so on. Is there someone who can help with that when I'm not here?
Yes, my partner can do that.
Great. So the last thing is to use an inflatable cushion, which I'll bring next time. And you can use this to lie or sit on, and it just spreads out the pressure and stops it from concentrating in one spot. Does that make sense?
Yeah, okay.
So those three things, changing position, checking your skin, and using the cushion, will be really good to do. Now, before I get started on the treatment I mentioned earlier, I do want to have a look at the sore just to confirm what stage the ulcer is, and also to do that skin check I mentioned. Would it be all right if I do that now?
Yes, thank you.
All right, I'll do that, and you just let me know if you have any questions or are worried about anything at all. All right?
Okay, I will.
Great. So lots of good answers I can see already coming through on the chat. We've had things about relationship building from Marie. Manu said about acknowledging the patient's problems. Aqua has talked about exploring and eliciting and empathy. Archibong has mentioned open questions and exploring. All of those are fantastic answers. So well done for all of you listening along and noting those down. Let's put up on the screen some of the other ways that perhaps you didn't pick up or that you also were thinking about but haven't had time to write down. So things like initiating the conversation appropriately, explaining the purpose of the visit with open questions, empathy, which some of you did mention, asking clarifying questions. So things like, can you tell me what you mean? Making sure you've really understood what the patient is saying to you. Using signposting language, so showing you're moving on to another topic. Summarizing what the patient has said and demonstrating active listening. So really showing the patient that you've heard what they've said by perhaps echoing or repeating back part of what they said to you. Asking what the patient already knows about bed sores is also another really good skill. So lots of really good ideas coming through from you, and you'll be able to listen again to the recording and notice if you can see all of those things that are on the screen now. We're nearly at the end of the webinar, so I'm going to hand back to May to talk about the final bits and pieces.
Thank you, Rebecca. Before we wrap up, let's talk about some valuable resources that you can help or that can help you to strengthen your speaking skills, not just for OET, but for real world healthcare communication. So you'll find free, complete sample tests on our website, something we're very proud of to offer. While most other tests only provide a handful of sample questions, we make sure you have full practice tests so you can truly experience what the exam will be before the test day. You can download them and practice with a friend or colleague if you're taking the paper based test, or use Zoom or other online platforms to really make you comfortable and for you to simulate the computer based or OET at home experience. It's a great way to get comfortable with the format and build confidence ahead of your exam. So, in the website, just tap or click the tab Ready and then Speaking. You can see all the speaking sample tests that you can see on the screen. We also have two booklets in the website explaining the assessment criteria for OET and also the score for the subtest. They are full, or they give you full explanation of what the assessors are looking for so you are guided, and useful language you can include in your role plays. They include more examples so you can hear where each one demonstrate strengths and weakness. Again, you can find them in our website. That's OET.com. And do not miss out on our official OET speaking course. This is 100% online and self-directed, so you can study when and how you want. It has a huge amount of training, including skills, strategies, and new sample tests, including real tests with assessor scores and comments, so you can see a live example. There are also some useful language in there at the end of it, so you can really work on your grammar and vocabulary. The course is available via the OET store. And then remember that you can use the coupon code that is OET Ready 25. Again, it will give you a 25% slash from the original price of our courses online. So, extra tips before we go. When preparing for a healthcare English test, we know it's not just about knowing the language, it's also being effective in a real world situation. That's why it's important to practice speaking in different scenarios, just as you would in a professional setting. One great way to do this is asking a friend or a family member to give you feedback. Feedback or receiving feedback is really crucial for your development. They can help you notice things you might not catch on your own, even though you record your voice. You can also take advantage of the free resources on OET.com and OET's YouTube channel, where you'll find expert tips and sample responses. Another helpful strategy is to record yourself while practicing. Well, sometimes I also do that. especially that my first language is not English. And it helps me really to practice English on my own. Listening back allows you to evaluate your fluency, pronunciation, and clarity, just like a healthcare professional ensuring effective communication with patients. And to finally work with a teacher to identify weak areas. Sometimes you have the resources in your hands, but you have to face a teacher to really boost your confidence. Do not worry, a trained instructor can help identify weak areas and provide guidance tailored to your needs, ensuring you're well prepared for test day. So you can have that option. You can go to our website, click ready, and there's an option there to study with a teacher. If you're in the Philippines, we also have partner language preparation providers so to really help you with your journey for OET. With the right preparation, you won't just pass, you'll gain skills that will serve you well in your healthcare. We will have more of these preparation sessions. So, to stay updated and posted for webinars, events, and discount promos, follow and like our pages and accounts on Facebook, Twitter, or X, LinkedIn, and YouTube. And for our Filipino Kunars, mabuhay, we have the OET Philippines, so like, follow, and subscribe. We're wrapping up this webinar series, but we have our final live session on March 11th. So be sure to tune in and be active, like just what I witnessed today. Thank you so much for your participation and time. You can catch it live on our OET Facebook page and YouTube channel. So wherever you are, you won't miss out. While this marks the end of the series, it's just the beginning of the next step in your journey. We know you may have questions, and we're here to help. With that, I'll hand it over to Rebecca to guide us through the Q&A section.
Thanks, May. We've just got time for a short amount of questions, but if we don't get to your question today, I will let you know that next week on Thursday, we'll be running a Q&A live session, which is something that we do every couple of weeks. So if your question isn't answered today, do join us again next Thursday for those questions. And as May has just said, the writing session is also next Wednesday. So more chances for you to get your questions answered. I will just pick up on a couple of questions that came through earlier in the session. This one came through from Bansari, who's asking about any specific criteria for pharmacy. So the criteria that May's been going through tonight and we've been showing on the screen and linking to on the ready pages are the same for all healthcare professions. So there are 12 healthcare professions that can take OET, including pharmacy, nursing and medicine, as well as some of our other allied health professions. So all of those role plays will be assessed against the same criteria. So everything that May has mentioned this evening is going to be of use to you as a pharmacist as well. And another pharmacy question, in fact, so it's great to have some pharmacists joining us for today's session. This is a question that we get asked as well by all OET professions. Sometimes if it says, if the first task says find out about the patient's symptoms, the onset, for example, do you have to introduce yourself? How would you start this role play? So yes, unless the background information specifically says, you know, you've met this patient before, or sometimes it might say you've just examined the patient, unless something like that is mentioned in the background information, the expectation is that you would introduce yourself. It doesn't have to be a long introduction, particularly for pharmacists where you can imagine the client has come in to visit you in your pharmacy. You don't often do really long introductions. You might just say, hello, I'm Rebecca. I'm happy to help you today. Please tell me about your symptoms, for example, or you might ask for their name too, but just something brief can often be sufficient. So thank you for that question as well. I'll just check. There aren't any more questions coming in, May, today, so I'll leave you to round it off.
Thank you so much to everyone in the world who viewed this session. Salamat sa ating mga kunars all over the world, not just in the Philippines, but in different parts of the globe. Stay tuned for other sessions, webinars, and activities in our OET Facebook page. Please also follow and like our OET Philippines page. We'll see you and magkita tayong muli. Bye!